Welcome to this pharmacology quiz on antifungal medications. In this video, we'll cover key antifungal drug classes and the common fungal infections they are used to manage. This quiz features 20 recall-type multiple-choice questions. Each question includes 5 options, followed by the correct answer and a brief explanation. The video will pause for a few seconds after each question to give you time to think before the correct option is revealed. So, let's get right into it. Question 1. Which statement best describes the mechanism of action of azoles in inhibiting fungal ergosterol synthesis? Option A. Bind directly to ergosterol. Option B. Block beta-glucan formation. Option C. Inhibit lanosterol demethylation. Option D. Disrupt fungal RNA synthesis. Option E. Inhibit squalene epoxidase. The correct answer is option C, inhibit lanosterol demethylation. This is because azoles block fungal CYP450 enzymes responsible for converting lanosterol to ergosterol. All other options involve mechanisms unrelated to azole activity and describe different antifungal targets. Question 2. All of the following statements about amphotericin B are true except the one concerning its toxicity profile. Option A. Causes dose-dependent nephrotoxicity. Option B. Can induce electrolyte disturbances. Option C. Causes infusion-related reactions. Option D. Has excellent oral absorption. Option E. Binds ergosterol to form pores. The correct answer is option D. Has excellent oral absorption. The reason is that amphotericin B has extremely poor oral absorption and is given parenterally for systemic infections. All other options accurately describe recognized features or effects of amphotericin B therapy. Question 3. Which triazole has superior CNS penetration due to its pharmacokinetic properties and enhanced distribution? Option A. Posaconazole. Option B. Itraconazole. Option C. Fluconazole. Option D. Isovuconazole. Option E. Ketoconazole. The correct answer is option C. Fluconazole. This is because fluconazole distributes widely into cerebrospinal fluid and is preferred for fungal CNS infections. The remaining azoles have poorer CNS penetration due to variable absorption, high protein binding, or limited distribution. Question 4. All of the following statements about echinocandin mechanism of action are true except the one describing incorrect target activity. Option A. Inhibit beta-glucan synthesis. Option B. Act on fungal cell wall. Option C. Have fungicidal action against candida. Option D. Inhibit ergosterol demethylation. Option E. Are ineffective orally. The correct answer is option D. Inhibit ergosterol demethylation. This occurs because ergosterol demethylation is an azole target, not an echinocandin target, making this statement incorrect. All other options accurately describe echinocandin properties, including their cell wall activity and lack of oral efficacy. Question 5. Which antifungal class is most appropriate when renal impairment limits amphotericin use and enhanced safety profile is required? Option A. Polyenes. Option B. Echinocandins. Option C. Allylamines. Option D. Antimetabolites. Option E. Topical azoles. The correct answer is option B. Echinocandins. This is because echinocandins have minimal renal toxicity and are preferred in patients with reduced kidney function. The other drug classes either have greater toxicity risks or insufficient systemic efficacy for this scenario. Question 6. All of the following drugs are echinocandins except the one that lacks beta-glucan synthase inhibition. Option A. Caspofungin. Option B. Micafungin. Option C. Anadulafungin. Option D. Rezafungin. Option E. Flucytosine. The correct answer is option E. Flucytosine. This is because flucytosine is an antimetabolite that inhibits fungal DNA and RNA synthesis rather than acting on beta-glucan synthase. All other options list true echinocandins with cell wall targeting activity. Question 7. Which azole shows reduced absorption with decreased gastric acidity due to its formulation requirements? Option A, fluconazole. Option B, voriconazole. Option C, itraconazole. Option D, posaconazole. Option E, isovuconazole. The correct answer is option C, itraconazole. This is because itraconazole capsules require an acidic gastric environment for optimal absorption. Other azoles have formulations or characteristics that bypass or are unaffected by changes in gastric pH. Question 8. All of the following statements about terbinafine mechanism of action are true except the one describing an incorrect biochemical target. Option A. Inhibits squalene epoxidase. Option B. Increases toxic squalene levels. Option C. Disrupts ergosterol production. Option D. Acts on fungal cell membrane. Option E. Inhibits beta-glucan synthase. The correct answer is option E. Inhibits beta-glucan synthase. The explanation is that terbinafine inhibits squalene epoxidase, affecting ergosterol synthesis and increasing squalene accumulation. All other options describe true features of terbinafine except the beta-glucan synthase mechanism, which belongs to echinocandins. Question 9. Which agent is preferred for oral candidiasis when systemic therapy is needed due to its clinical efficacy? Option A, nystatin. Option B, amphotericin lozenges. Option C, fluconazole. Option D, clotrimazole. Option E, miconazole. The correct answer is option C, fluconazole. This is because fluconazole provides reliable systemic activity and excellent clinical cure rates for oral candidiasis. Other listed agents are mainly topical or less effective for systemic treatment needs. Question 10. Which drug is the first-line agent for topical therapy of oral candidiasis, reflecting optimal local activity? Option A, fluconazole. Option B, nystatin. Option C, voriconazole. Option D, caspofungin. Option E, itraconazole. The correct answer is option B, nystatin. This is because nystatin has potent topical antifungal action and is well established as first line for local oral candidiasis. The other agents are used systemically or are unsuitable for routine topical therapy. Question 11. Which azole is most associated with visual disturbances due to its unique pharmacodynamic effects? Option A, fluconazole. Option B, itraconazole. Option C, ketoconazole. Option D, voriconazole. Option E, posaconazole. The correct answer is option D, voriconazole. This is because voriconazole commonly causes transient visual disturbances due to its CNS-related effects. All other azoles do not typically produce this characteristic visual toxicity. Question 12. All of the following statements about flucytosine are true except the one describing inaccurate toxicity or use. Option A, causes bone marrow suppression. Option B, requires renal dose adjustment. Option C, used mainly with amphotericin B. Option D, acts by inhibiting DNA synthesis. Option E, has excellent oral bioavailability. The correct answer is option A, causes bone marrow suppression. The explanation is that bone marrow suppression does occur, making this a true statement and therefore the incorrect one in the context of an except question. All other options accurately reflect recognized pharmacology and use of flucytosine. Question 13. Which drug is preferred for systemic treatment of onychomycosis based on superior clinical outcome? Option A, griseofulvin. Option B, fluconazole. Option C, itraconazole. Option D, nystatin. Option E, amphotericin B. The correct answer is option C, itraconazole. This is because itraconazole pulse or continuous therapy has high cure rates for onychomycosis. The other agents have lower efficacy, limited activity, or are unsuitable for routine systemic nail infection treatment. Question 14. All of the following antifungals are used for systemic infections except the one lacking systemic therapeutic use. Option A, fluconazole. Option B, caspofungin. Option C, amphotericin B. Option D, nystatin. Option E, voriconazole. The correct answer is option D, nystatin. This is because nystatin is not absorbed systemically and is used only for topical or mucosal infections. All other agents achieve systemic levels appropriate for invasive fungal disease. Question 15. Which echinocandin exhibits the longest half-life allowing extended dosing intervals? Option A, caspofungin. Option B, micafungin. Option C, anidulafungin. Option D, rezafungin. Option E, flucytosine. The correct answer is option D, rezafungin. This is because rezafungin has a markedly prolonged half-life that supports once-weekly dosing. All other echinocandins require daily dosing and lack this extended pharmacokinetic profile. Question 16. All of the following statements about azole use in pregnancy are true except the one describing incorrect safety information. Option A, azoles are generally avoided. Option B, high-dose azoles cause fetal toxicity. Option C, amphotericin is preferred. Option D, fluconazole is always safe. Option E, topical azoles may be used. The correct answer is option D, fluconazole is always safe. This is because fluconazole, especially at higher doses, has known teratogenic associations and cannot be considered universally safe. Other listed statements reflect accepted safety principles in pregnancy. Question 17. Which agent provides the most potent fungicidal activity for induction therapy in cryptococcal meningitis? Option A, fluconazole. Option B, flucytosine. Option C, amphotericin B. Option D, itraconazole. Option E, posaconazole. The correct answer is option C, amphotericin B. The explanation is that amphotericin B remains the strongest fungicidal agent for initial management of cryptococcal meningitis. Other drugs serve adjunctive or consolidation roles and lack equivalent rapid fungicidal potency. Question 18. Which drug directly inhibits beta-glucan synthesis and is effective in candida infection? Option A, voriconazole. Option B, caspofungin. Option C, fluconazole. Option D, terbinafine. Option E, amphotericin. The correct answer is option B, caspofungin. This occurs because caspofungin blocks beta-glucan synthase, weakening the fungal cell wall. The other agents target ergosterol or other pathways and do not inhibit beta-glucan synthesis. Question 19. Which azole shows the broadest antifungal spectrum with enhanced mold coverage, including mucorales? Option A, fluconazole. Option B, itraconazole. Option C, ketoconazole. Option D, posaconazole. Option E, clotrimazole. The correct answer is option D, posaconazole. This is because posaconazole has extended activity against molds, including mucorales, surpassing the spectrum of other azoles. The remaining agents lack reliable activity against these resistant mold species. Question 20. All of the following factors affect amphotericin B nephrotoxicity except the one unrelated to renal injury risk. Option A, concomitant nephrotoxins. Option B, total cumulative dose. Option C, liposomal formulation use. Option D, hypovolemia. Option E, low potassium levels. but correct answer is option E, low potassium levels. This is because low potassium is typically a result of amphotericin toxicity, not a cause increasing the nephrotoxic risk. All other choices directly influence the likelihood or severity of amphotericin-associated renal injury. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.